Now, what are the consequences or what are the risks of gastric bypass? Remember, I'm not here to demarket gastric bypass. I'm also not here to market gastric bypass. I'm here to point out the issues that come as a result of gastric bypass, and if at all, it is the best way to lose weight. And of course, if you ask me the best way to lose weight, I'll tell you that the best way to lose weight is through diets, dietary modifications. If you cut off carbohydrates, if you cut off sugar, if you cut off those sugary sweets and confectionaries, and if you cut off modern fruits and those seed oils, basically you start losing weight, and it's very doable. If you start fasting again in combination with keto diets, healthy keto diets, then weight loss is just a story of the past, okay? So these are basically what people consider as quick fix. This one, the gastric bypass and the gastric balloon and also liposuction, just to suck fat around your tummy. So these are just basically quick fixes, and in this channel, we do not encourage quick fix. What we do is we encourage lifetime modifications that help you lose weight and recover from chronic conditions. And this is not part of it. Now, again, remember, you've reduced the amount of food that you want to eat, but you're still eating the same foods. So you're not helping out, because that's why I believe this has to be a procedure that a nutritionist has to be involved deeply, because they have to encourage you to know what foods that you have to quit and what foods you have to continue eating for you to aid yourself in weight loss, and also in conjunction with this gastric bypass. So the risks of this, basically, number one, we've just mentioned anxiety and depression, because your eating habits have now changed instantly and you have to adapt to that. So most people get into anxiety and depression, and this can get weird, because once you get into this, then you'll have to go back to a doctor, and then they will have to prescribe you anti-anxiety drugs or antidepressants. And that is another big problem, because remember, antidepressants cause issues with the gut. So if you already have a gut surgery and then you go for antidepressants, then you'll end up in more trouble, okay? Then hernias. I already explained to you how hernia can happen. That portion of the stomach that has been set aside to help you eat less quantities of food can pop up beyond the diaphragm, and that is one type of hernia. So that is a complication again. So you would want to consider all these risk factors before you get into this surgery. So another one has to be malnutrition, and malnutrition is basically, since you've bypassed this stomach, so you've bypassed the entire stomach, and vitamins, amino acids, and other, basically B vitamins and fat-soluble vitamins, some of them are absorbed in the stomach, like vitamin B12, which is the intrinsic factor. So B12 is a very important vitamin in nerve function, and also it also aids you in absorption of iron, which helps you to reduce your chances of getting anemia. So it's very important. So imagine if you've bypassed the stomach, and then you'll have deficiencies in vitamin B12, and therefore you'll have all these nerve problems. Okay. Also, you'll have anemia, because anemia is one of the complications that come as a result of deficiency of vitamin B12. Okay. All right. Then again, other minerals like calcium, iron, and iron also plays another important role in blood formation and blood boosting. And therefore, if you lack iron, then you get into anemia. So these are just basically the complications of this surgery. So for B12, you'll get nerve problems. For iron, you'll get anemia. And for calcium, you'll get bone problem and osteoporosis. So those are just the list that can happen to you. Then the ADEC, vitamin A, D, E, and K. These are fat-soluble vitamins. And in this channel, we have discussed fat-soluble vitamins in details. So you can imagine, just like just a point out, on A, you'll have problems with vision and also the skin. Okay. On D, you'll have problems with the immune system. And remember also, D is an immune stabilizer. Therefore, you'll have issues with the immune system. Also, the bone in conjunction with calcium, because vitamin D plays a very important role in sending calcium and phosphorus to the bone. So you'll have osteoporosis. Now, vitamin E is an antioxidant in the system, helps the liver to detoxify your body. So if you don't have it, then toxins start to build in the body. And vitamin K plays a role in blood clotting. And therefore, the deficiency in vitamin K, you'll have blood clotting issues. Then hair loss. Of course, hair loss is basically because of a deficiency in vitamin A. So these are skin conditions. Also anemia, we've talked about iron. Then osteoporosis and bone problems, we've talked about vitamin D and also calcium. And then nerve damage as a result of vitamin B12. So those are just basically the least symptoms that you can get, or the least risks that can come as a result of gastric bypass. Number two has to be long-term complications. And these complications are basically, number one, bowel obstruction. Now remember, you've reduced this size of the stomach, and therefore the food that is coming in has to go straight into the small intestine. Remember, this is a large surface area, but now you're passing food from the small one into the smallest portion of the small intestine. And that means you'll have obstruction, and that's the reason why these people pass a lot of air, a lot of gas, okay, because of indigestion, because of obstruction, and because of basically protein indigestion. So this is as much as it's helping you, but it's also bringing you complications. And as we keep on going, we'll see that the complications are much more than the benefits. Okay, so that is bowel obstruction. Then we have perforations and ulcers. So now you've cut off this portion, you've made an ulcer, and this can worsen the complications. Also remember, as just like any other surgery, once you involve surgical interventions, then you expose your body to inflammation and also infection. So that has to be another long-term complication: inflammation and infections, and bleeding and clots. Now this gets weird because remember we've said you don't have vitamin K for clotting, but these blood clots, because this will be a long-term complications. So vitamin K can help you not to clot, so you can bleed to death. Also, these clots can start forming when you have that surgery. This can be classified under the earliest signs or earlier risks of gastric bypass. So basically those are under complications, long-term complications. Now, the most important part of this is something called the dumping syndrome. So what is the dumping syndrome? Dumping syndrome basically means you will experience nausea, vomiting, diarrhea, and even constipation and indigestion as a result of this. And how does it happen? When you eat, you're eating your food and it's going straight into the small intestines. So it is bypassing the larger portion of the stomach, which has the gastric juices, which has the HCl that helps you detoxify food and microbes in the food, which helps you digest protein. And you're bypassing it, going straight into the small intestines. And therefore, you will have all those symptoms, the dizziness, you'll have all this diarrhea and vomiting. And that is what we call dumping syndrome, because food that you're eating is going straight from that small portion of the stomach into the intestines, and that is not the biological way. The biological way is food has to go into the stomach, be channeled into chunks, be mixed up with that acid, then some of it be digested in the stomach as it heads into the small intestines to produce the pancreatic juice and the bile juice, so that you can break down the fat and then excrete the food. And that happens in the duodenum. And remember, we've bypassed the duodenum straight into the jejunum. So that has to be a problem, and that's what we call the dumping syndrome. So the dumping syndrome is one of the most common effects of gastric bypass. And therefore, if you ask me in conclusion, I'll tell you that gastric bypass is a way that is considered as a quick fix to help you lose your weight. However, anything that involves faster or quick fixes is a problem, is end you in problems. And therefore, we encourage you to take stepwise and processes that will help you to lose weight, so that you can even be an ambassador of weight loss processes, because you understand the process. If you go through that process, you will know the issues that come as a result of what you eat, and you will understand that you are what you eat. And therefore, these quick fixes are for people who just totally do not have discipline of eating. We take exceptions to people who are definitely obese and extremely obese, and they want to lose weight faster, and maybe it's a high risk to them and their health in general. However, other people who go ahead and do these surgeries, they spend a lot of money on these surgeries, and it's proving ineffective because because what you eat is what you are. And therefore, if you focus on diet, it will be easier for you to lose this weight, and you'll get to understand the process. And going through the process is the most important thing in this life. And therefore, these are just basically the risks that come as a result of gastric bypass.